Good morning. So I'm Kate. I'm a community organizer. I spend a lot more time in church basements than university auditoriums, so I'm very excited to be with all of you today. And I should just confess, I'm not a public health expert. I'm not a public policy expert. Where my expertise lies is how do we bring communities into action to advocate for themselves and their lives and get the things they need to thrive in the world. And I'm deeply, deeply passionate and deeply believe that to build a thriving country, we need to have everybody in and nobody out. And we need everybody participating in our democracy. So I work for Isaiah, and Isaiah is a faith-based organization working on racial and economic justice, both in the Twin Cities metro, the suburbs, and greater Minnesota. And about 10 years ago, we started to look at health equity. And like many other fields, we felt siloed in our work. So we would work on affordable housing over here, or a transportation project over here, or minority hiring here, but saw health equity as a way to unite and align a common narrative and a common purpose for our work, and started to explore what that would look like. So there's three things that we're always focused on, and the first one up there is the most important to us, which is how do we build community power and capacity through organizing. So that means we don't advocate for other people, but we put them at the center of the decisions that are affecting their lives. The second thing that we wanted to start exploring as community organizers is how do we incorporate data and research into community campaigns, which was a new thing for us. And third, as we got to understand that health wasn't just the children's health care that we were advocating for and access to the doctor, but a whole myriad of other factors, how do we advance and change a public narrative about who has access to health, who's healthy in our state, and how do we change that? So I'm sure many of you have seen charts like this. Our public conversation around health tends to largely be in the clinical care. It's also a huge part of our economy, which is why it's so much a part of the public debate. But 50%, so I'm counting social and economic factors and our physical environment, are not located at the doctor's office, but are located in the decisions made at the Capitol and at our city councils and at the county level, which means health is political. Health is controversial, and that people are routinely impacted by these decisions and not able to necessarily influence them. So as organizers, we say, why would you live next to this or this? What determines that? And we would say, it's the amount of power you have in our society. So whether or not your voice is heard at any governmental level has to do with that power. So I'm going to talk in a little bit about some of the projects that we've worked on, the Central Corridor Light Rail line and this alignment between community organizing and public health. But my work in St. Paul on the Central Corridor Light Rail line was really influenced by decisions that had been made a long time ago, by I-94 going in through the Rondo neighborhood, which had been a thriving African-American neighborhood. And the wounds of that eminent domain and the destruction of that community were still present 40 years later. What I didn't know at the time was that the siting of I-94 had originally been thought to go on Pierce Butler Road, which was a wider and more affluent area, and had been moved down and sited in the African-American neighborhood. And that was about power and who had power and influence at the city, county, and state level. So community organizing, our president was a community organizer, but it's largely an unknown field, which is somewhat our fault too. But it is a field, it is a practice, it is a profession. And it looks different in different places. So I do congregational-based organizing, there's labor organizing and neighborhood organizing. But at its basic form, it's a set of disciplined and strategic practices to build democratic and collective power to assure the conditions in which communities can thrive. And our primary focus is on leadership development. So it is not me going to advocate for other people, but instead working with people for their own voice and the voice of their neighborhoods and the people in their churches to speak out to make change, transformational change in their lives. So, before I became an organizer, who's seen Selma here? Okay, so before I became an organizer, I had this idea that if there was a march or there was a rally or people were upset, that they somehow spontaneously rose up and got into the streets. That doesn't happen. It's more like a star with a gravitational pull. There are always a set of strategic thinkers and leaders at the center of movements. So if you saw Selma, you saw a set of people thinking about how do I get more and more and more people engaged in this struggle. So organizing in its current form has about a 40-year history, and traditional organizing was fairly siloed and relatively distrustful of working with academic institutions, and somewhat for good reason, because our fear was that to put anything but the primacy of people's stories and experiences, to put anything above that was going to take away from our people and our communities. But I do deeply believe that was a mistake. I think we've learned in the last 10 years that partnering with public health, partnering with academic institutions, and bringing research and data into our campaigns has taken us a huge leap forward, especially when the research and data is controlled and led by the community themselves. So my understanding, too, and what I've heard from all of you, is that your fields have also been siloed and disconnected. And so this work of health equity then gives us a common place to come together and see what are our different roles and how do we advance this mission that I believe you also agree that everybody deserves the opportunity to thrive. So we did start to think about, well, how do we partner with institutions? And we had a couple things that we wanted to make sure we were clear about. So for us, policy change is one slice. But the longer-term project is how do communities, if they're faced with poor housing and poor education and violence and ongoing structural racism in their communities and in their schools and institutions, there is not one single policy that will be a silver bullet for that. So what they need is a continuing ability to build their own power, their own voice, and advocate for themselves so they can be nimble in addressing the things that they are up against. We wanted to have supportive and inclusive methods, understanding that expertise looks different in different places. So there is academic expertise. There is also the expertise of, I know my neighborhood. I know who lives here, and I know what's working, and I know what's not. Understand that this is a long-term project, and then I wanted to make a distinction between community engagement and community organizing. So sometimes they're used interchangeably. They're not. Community engagement is good, but it tends to be project by project. It's not engaging communities over the long term, and it's a little bit more transactional. So organizing is focused on long-term power building for communities and shared power for whoever comes and sits at the table. So one of the first things that we did is to start to look at health impact assessments as a way to advance equity. And I'm so glad that you laid out what an HIA is. It makes my life so much easier. But we thought this could be a way to equip community leaders with their own research. They could ask the questions that were going to be answered in the report, and then they could use that when they go and work on their campaigns. So we have done 2 HIAs so far. The first I led, and I'm going to talk about, which is the Healthy Corridor for All project. We also did a rapid HIA on school integration strategies. We've been working for a long time on the racial disparities in Minnesota's public education system. And then currently are exploring an HIA on debt, the impact of debt on the body, especially people that are stuck in payday lending traps. So the Healthy Corridor for All was a project with Isaiah, PolicyLink, and Take Action. Isaiah had worked on the corridor for quite a while leading up to this. So we had advocated for transit funding. The line was then designed. And as it was designed, 3 stops were pulled out of the line. And those 3 stops were in the poorest neighborhoods, the neighborhoods with the highest concentration of people of color, and the most transit-dependent neighborhoods. So we spent 2 years advocating for those stops to get put back in. We had to go all the way to this is with a coalition of people. We had to go all the way to the federal level because it was about efficiency standards. and got those 3 stops put back in. Now, once the stops are put back in, and we're putting $1 billion into our city and state, we had to ask, well, is this actually going to work for the people that live, work, worship along the line? So that's where we started to look at health impact assessments. Could this be a way to understand how this project was going to impact people? So we decided to look at the zoning plan that was being developed along the line. And we wanted a zoning plan that would maximize opportunity for health and equity. And then we were going to build a community steering committee that was going to advocate for their vision. The most important thing, and the thing that I believe in the most about our HIA, above any of the outcomes, is how we set the table. So we set the table with the community steering committee at the center, and that was 22 constituency groups. So constituency groups meaning not rogue individuals, but leaders in the community that had a following behind them. So that was pastors of churches up and down the line. It was people that had worked on housing and that lived in the neighborhood. So Eve was on the steering committee. She had grown up in Rondo. Her salon was in her house, and her home was deeply underwater. So she had gotten engaged in trying to figure out, how do we improve housing in the neighborhood? When we brought her on, we had Hmong business owners, we had bus drivers through the bus drivers union. And they were at the center, and when we set a room up, they would be at the center. And then we had a technical advisory panel, which was urban planners, lawyers, public health, who provided significant expertise both on what's an HIA and how does it work. Also, what is zoning, this complicated, and how does it actually impact your everyday life? But they had no decision-making power. So we wanted to identify the most important issues for the community, and we did this through an unglamorous process of flip charts with different issues that they had put up and voting by dots, which actually worked. It works very well. And then we wanted to develop a plan, and so PolicyLink did our research, but the Community Steering Committee came up with the questions that they wanted answered about this huge investment in their neighborhood. So then we looked at the current conditions of the corridor, came back to the steering committee with that research. They had a whole other set of questions, and then did the forecast on how the zoning was going to impact their prioritized issues. And then out of that developed recommendations. So their prioritized areas were housing, two parts of housing. Can I stay in my house, or am I not going to be able to afford to live here? And is there going to be new affordable housing here? Transit, so not just the line itself, but will there be exterior lines going out? And will it be safe to walk and bike in my neighborhood still? And then healthy economy. So that meant, will there be jobs that pay well, that I can get? And will small businesses be able to stay? I'm skipping there. So as we got research in and as we were focused on zoning, it became clear that housing rose to the top for the steering committee in terms of both what we could impact at the city level, but also what people were most worried about. And we both in the current assessment of the line and the projected forecast, affordable housing was going to be an issue. Property values were already rising, and this was a year and a half before the light rail actually came. And people were very nervous, especially with what had happened with I-94 through Rondo. There was historical wounds about public policy decisions. So we then went through a series of meetings with decision makers. There was testimony given at both the Planning Commission and the City Council. We held a series of public actions. Now we're moving from the data part to the organizing part. The advantage of this was that every person that met with their city council person then had a credible research with integrity that they understood that they could bring in to talk about what was happening to their neighborhood. So through that work, we had a resolution passed, an anti-displacement resolution. The commissioned a study on density bonuses, which is gives developers, they can go higher if they include affordable housing. Over $1 million was allocated for affordable housing in St. Paul. And then the last point I want to make is that when we do this work about sustained community power building, it can lead to significant other work. So what we found in Frogtown and Rondo during this time period as we were door knocking was significant amounts of vacant homes, people that were moving out because foreclosure, or people that were underwater or unsure of how they were going to pay their mortgage. And Eve, who I mentioned, was also one of those people. So that led to then a significant foreclosure effort that led to some of the strongest statewide legislation passed to protect homeowners from being foreclosed unfairly by their banks. So the other space that I spoke about was changing the public narrative about health. And so Isaiah and a set of community organizing allies has worked for a while on worker justice issues, on economic justice issues. In 2014, we worked very hard to raise the minimum wage to $9.50. So through that and through our work on economic justice, began to realize that we needed to change the public conversation. Those at both the national and the state level, when you think about workers or economic justice, it becomes a battle between business and workers. And there's no other conversation to be had. So we worked with the legislature and asked them to commission the Minnesota Department of Health to do a white paper on income and health, to understand how wages were impacting people across Minnesota. And then most recently, we did the same thing on paid leave and health. And this one just came out last month. So the income and health paper then led to a press conference with Commissioner Ellinger and a set of other allies, where then it was stated that low-wage workers were dying 8 years younger than their middle-class counterparts, which that's a different conversation. It's a different conversation about wages and what matters for our society than it being just a fight between business and workers. And again, these things, when they're grounded in the community, can really grow beyond the scope of what we thought. So this is Say Tool. They're a retailer janitors organization. They organize janitors that clean Target and Best Buy, and they read the report. And they started talking to their janitors about their health. And janitors began to tell stories about working 2 jobs, about going to work sick, about not being able to take care of their children. And they then did their own report based on the research from the health department. And they used that in their negotiations with Target. And through that process, Target implemented a corporate-wide policy on responsible contracting, which means that every single Target store now has certain labor standards for how the janitors are treated in their store, and that they can work towards collective bargaining in their stores. So the impact of data and research being grounded in a way that people can access and understand and then relate to their own experience has been an incredible learning for us. The second piece here is just an ongoing work that we're doing around paid family leave and earned sick time, and really grounding that in a health conversation instead of just a primarily economic conversation. So there was a great piece just a few weeks ago in the Star Tribune about the health impact of paid leave. So this is ongoing work. We've learned a lot. I would say that understanding different roles across organizations and across disciplines has been huge for us, and commitment to understanding this different expertise. One that's not up here that I've been reflecting on a lot is we have learned so much about how incredible data and research at the hands of the community is and in our campaigns. The flip side of that is that data and research in the hands of the community tends to be seen as less credible. And I don't know how to reconcile that, but it's something that we're constantly up against, that our research and data, even if PolicyLink did it or the university did it, if we are using it to advocate, it is less credible. So another thing I just wanted to say, so we consistently put racial equity and an ongoing conversation about race at the center of our work. As a white person, regularly entering into tension around race, understanding that there are no race-neutral conversations and no race-neutral policies, and that my experience is not universal and cannot be totalized. and that is going to be at the center of addressing health disparities, and we deeply believe that. And then the bottom is just to reiterate, in order to have long-term impact on the things that are really damaging people's ability to live healthy, full lives, we need communities at the center of their own power building and at the center of our democracy. So with that, thank you so much.